Pharmacy exam MCQs. So today's first question. Ethyl alcohol is administered to patients who have ingested either ethylene glycol or methanol because options are help sedate patients, increases the metabolism of ethylene glycol and methanol, blocks the formation of toxic metabolites of ethylene glycol and methanol, increases the renal clearance of ethylene glycol and methanol, is not an antidote for ethylene glycol or methanol overdoses. Correct answer is option C. That is, this ethyl alcohol blocks the formation of toxic metabolites of ethylene glycol and methanol. Ethanol saturates alcohol dehydrogenase and prevents the formation of the toxic metabolites of either ethylene glycol or methanol. However, this antidote is falling out of favor owing to its adverse metabolic and central nervous system effects. Fomepizole, a specific inhibitor of alcohol dehydrogenase, is becoming the preferred antidote for methanol or ethylene glycol overdoses. Ethanol may be used in situations in which fomepizole is not available. A patient with renal failure is inadvertently given 3 doses of potassium chloride 40 milliequivalent IV in 100 ml of 0.9% sodium chloride over a 3-hour period. This error is immediately discovered and a stat serum potassium level is 8 milliequivalent per liter. The patient is bradycardic with a markedly prolonged QRS complex. The patient should receive which of the following? Options are calcium chloride 10% 10 ml IV push, sodium bicarbonate 50 milliequivalent IV push, insulin 10 units and 50% dextrose 50 ml IV push, sodium polystyrene sulfonate 30 gram by mouth every 3 hours for 4 doses, none of the above. So here the answer is option A, that is calcium chloride 10% 10 ml IV push. All of the selections are used to manage hyperkalemia. That is, all these options or all these selections are used to manage hyperkalemia. Hyperkalemia means increased serum potassium level. Although in an unstable patient, the cardiac effects of hyperkalemia must first be reversed with intravenous calcium. Parenteral calcium is used as an antidote for which of the following situations? Options are verapamil overdoses, hyperkalemia, cocaine intoxication, verapamil overdoses, and hyperkalemia. Correct answer is option D, that is verapamil overdoses and hyperkalemia. Verapamil is a calcium channel blocker. Parenteral calcium is used to reverse the cardiac effects of calcium channel blocker overuse and hyperkalemia. A 16-year-old woman is reported to have overdosed on 40 sustained release theophylline tablets. She is transported to the emergency department where gastric lavage was performed and she was given 1 dose of activated charcoal. An initial theophylline level is 42 gram per ml, but a follow-up level in the intensive care unit is 95 gram per ml. What is the most appropriate course of therapy? Options are charcoal hemoperfusion and multiple dose activated charcoal, syrup of ipecac administration, forced alkaline diuresis, nasogastric administration of sodium polystyrene sulfonate. So here the answer is option A, that is charcoal hemoperfusion and multiple dose activated charcoal. Large ingestions of sustained release products may act as drug reservoirs, necessitating aggressive measures to remove the toxin. Hence, we have used this charcoal hemoperfusion and multiple dose activated charcoal as the appropriate course of therapy. A 23-year-old man is admitted to the intensive care unit after ingesting 20 acetaminophen tablets 500 mg with a 6-pack of beer. He was initially awake and alert in the emergency department and was given 1 dose of activated charcoal. His initial acetaminophen level taken approximately 2 hours after ingestion is 90 gram per ml. What would be the most appropriate course of action? Options are administer repeated doses of activated charcoal and sorbitol, administer syrup of ipecac, administer a loading dose of N-acetylcysteine, and repeat the acetaminophen level in 4 hours. Discharge the patient to home. Here, the correct answer is option C. That is, administer a loading dose of N-acetylcysteine and repeat the acetaminophen level in 4 hours. Large acetaminophen injections, that is 140 mg per kilogram, may be fatal if unrecognized. The Rumac Matthew nomogram requires a 4-hour level to accurately assess the potential for toxicity. If the 4-hour level is in the toxic range, the full course of N-acetyl cysteine therapy should be administered. So that's all for today. Thank you and have a great day.